Hello everyone, I am Dr. Siddhartha Mani, Consultant Interventional Cardiologist at RN Tagore Hospital, Mukundapur, Kolkata, and NKPC Kidney Clinic, Purbalo. Today is a special day. Today is International Yoga Day. In present world, in present medical science, the importance of yoga is being stressed and given importance all across the world. And you will be surprised to know that after complex cardiac surgeries like angioplasties or coronary artery bypass, previously age-old notion was that patient needs bed rest and very slow rehabilitation. But in present scenario, that very next day after the surgery, we recommend our patients to get mobile, to get walking, climb stairs, and we try to mobilize the patient the very next day. And that is very important to maintain proper circulation, proper cardiac function, heart rate, blood pressure, management of diabetes, hypertension, that is the risk factors. So all these are very closely connected with physical exercises and particularly yoga. Yoga therapists all across the world, they are experts in this and you can always consult them. We are not particularly yoga therapists, but today on this occasion, being a cardiologist, I would like to share you about one or two asanas which we particularly think beneficial and important from cardiac point of view. And which will help to maintain or control your heart rate, blood pressure, and cardiac functions. So basically, I will talk about two asanas today. One is Bhujangasana and a little bit variant of that is called Salamba Bhujangasana. I mean, it is just two variations of Bhujangasana, which is also called as the Cobra pose. So there will be therapists who will demonstrate this asana to you. I will just give a brief description of how this is performed and what are the beneficial effects of these asanas in the body. So if you look into the Bhujangasana, first of all, you have to lie flat in a prone position, that is flat on your stomach. It is not the usual position where you lie. You have to lie it prone, that is on a reverse way on your stomach. The feet has to be together and the palms flat on the floor just below or at the level of your shoulder. Now you have to keep the elbows close to the body and the forehead should rest on the mat before you start. So at the start, your forehead is resting, you are lying prone, and then you inhale slowly and press through your palms to lift your chest and head upwards. So basically, you start with a prone position and your forehead is touching the mat or the ground. You are lying completely prone and then gradually giving pressure on your palms or on your arms. You are gradually lifting the upper part of your body, lifting your head and shoulder to upright or a semi-upright position. So that is how it looks like a cobra or a snake raising its fangs. So that is why it is also called as a cobra pose. And then you roll the shoulders back and down, opening the chest fully. So you have to open up or expand your chest fully, and the lower part of the body, that is from umbilicus or the navel to the downwards, that remains prone and flat on the mat. So you are just raising the upper part of the body from the mat, giving pressure on your hands, keeping your elbows straight and close to the body. So in this position, you hold your body straight, breathe deeply, maintain a comfortable back bend, that is bend the back slightly, maintain it in a comfortable position. It is not that you will stress too much or stretch too much. And then gradually you exhale, and once you exhale, you come back to the previous or the initial position. So your body, the upright part of the body gradually comes back and your forehead again touches the mat. So this holding of breath in the upright position is around 20 to 30 seconds. So you have started rising your upper part of the body while inhaling, held the body in upright position and slightly bend backwards position for 20 to 30 seconds, and then gradually you are exhaling and coming down. So you can understand that this is not a very tough, this is not very stressful for your body. Even those who have knee problems or low back problems or other orthopedic issues, they also won't have much of a difficulty in performing this asana. Now this asana, it strengthens the spine, and as you can understand that you are expanding the chest, it is opening the chest, it is helping in expansion of the lung and the hearts, and also it is improving the gut mobilities, the gut movements, the blood flow in the abdomen, pancreas, like that. So by this way, it on one hand it is improving your abdominal organ circulation, and on the other hand it is helping your cardiac functions because it is helping expansion of the chest, it is helping the cardiac contraction and circulation. And then obviously because you are inhaling deeply in an upright posture, your lung expansion is also improving. So basically these are the beneficial effects. It also has some good effects on your spinal strength, the paraspinal muscles, they get strengthened. And you know that in cardiac patients, it is not always only about the cardiac circulation. It is also about preserving the muscle mass. It is also about preserving the circulation in other parts of the body like the brain, like the gut, abdomen, and all those. So every organs are closely related, and that is how this asana will help in stress relieving and proper circulation all across the body. Almost similar asana but with a slightly variant. In this, this is called Salamba Bhujangasana, and here you do not keep your arms straight, rather you fold the arm at the elbow. So here you are lying flat, similarly prone on a stomach with the legs stretched out. The forearms are lying flat on the mat. So the forearms only, not the entire arm, or I mean not the palm, it is the entire forearm. So in the previous asana I was telling that the palms will touch, and now the forearm from the elbow up to the tip of the fingers will touch the ground. And then gradually again in this position you inhale, lift your head and chest, upper part of the chest, gaze forward, slightly upwards. You can keep the neck slightly bent backwards and relaxed. Hold the breath for 20 to 30 seconds, and again you come down to the initial position. So these are the two asanas here. Similar activities are going on because you are stretching up your body upright, you are expanding, you are helping expansion of the chest and lungs and cardiac functions, and obviously you are improving your spinal flexibility, paraspinal muscle sections, and as I have already discussed, it will lead to improved circulation in different organs, not only heart but also other organs. So I just gave you a glimpse of two asanas, but there are numerous asanas and there are numerous postures and positions which you can perform. You can do, along with that you can do light aerobic activities, aerobic exercises, and even those who are not able to perform this, even simple brisk walking, even swimming, these are also very beneficial for cardiac functions and rehabilitations. So be in some activities, try to keep yourself mobile, because that not only improves cardiac circulation, it helps to control your blood sugars, cholesterols, it improves the HDL or good cholesterol. So there are numerous beneficial effects. So I want all of you to take a resolution on this yoga day, that in the upcoming days you will take some time out of your daily routine and perform yoga regularly. Thank you.